Information from this video is not to dispense medical advice nor prescribe the use of information as a form of treatment for medical problems. Please always consult with your physician or medical team on questions you have.
Hi, my name is Judy Macias Harris. I'm a certified speech language pathologist and instructor of the kinesiotaping method. In this series, I'll be discussing the significance of breath and its relationship to oral cavity and systemic health. I'll also share what I do to gauge oral cavity health as a possible factor to dysfunction. Again, thank you for taking the time to hear me mention prevention. I had an opportunity to speak with Clancy on the significance of breath and its relationship to oral cavity and systemic health. Tara is a certified educator who specializes in breathing and sleep education. She's affectionately known as the Sleep Sensei and knows that helping people who unwittingly get counterfeit sleep is a key to transforming lives. She's also the creator of the O2 Tara Guides Health Series. Here's what we discussed. Good morning. So Tara, we'll be discussing today about breath and how it affects oral cavity conditions. So let's just start off first by talking about the significance of breathing, specifically nasal breathing on global systemic health.
Sure thing, Judy. I love talking about this, so thank you for asking. So I always like to think about breathing in terms of where it is and how important it is for us to stay alive, right? So I talk about the core four. And if we think about the core four things that we need to stay alive, let's first look at number four. That would be food, right? We need food to stay alive. But hunger strikers and even shows like Survivor and whatever have shown us that we can go for weeks and sometimes even months without food. So that's a core need, but we can last for a while without it. Let's look at number three then. Number three is water. And with water, it's really important to us because our bodies are made up, about 80 or so percent of water. But still with that, we can go for a couple of days without water. Let's look at number two. Number two is really sleep. We have realized with technological advances that we really do need sleep. There's a very important stuff that goes on during sleep. And after about 24 hours of no sleep, we really start to show the effects and our minds start really rapidly deteriorating on us. And even, if you get less sleep than you should, even like 4 hours of sleep, you will show similar effects as somebody who is driving under the influence, somebody who's been drinking. Yeah, so it really, sleep really affects us tremendously. So those are, spots 4, 3, and 2 in this core four. But what is number one? Breathing, right? Air. Because without air, we have mere minutes to last. So it is indeed the most important physiological function that we have in our bodies. Now, that means we're doing it all day, every day, right? And of course, when you're doing something all day, every day, it absolutely has to go to the back of your mind. It has to operate in a way where you're not thinking of it, because otherwise you'd never get anything done. So what ends up happening is, because it has to go to the back of our minds, because there's so much other stuff that we're doing and so much of our modern lifestyle, we end up developing poor breathing habits.
Yes, I agree with that completely. So in my line of profession, I see a lot of open mouth posture for breath. I see a lot of forward head flexion. I also see a lot of forward flex shoulders. For me, that represents difficulty breathing or dysfunctional breathing. Can you elaborate a little bit about that?
Yes, absolutely. Let's start with the open mouth posture that you talked about. Let's talk about what the opposite of that is, right? The opposite of that would be actually breathing through your nose, right? If you think about the size of your nostrils compared to the size of your mouth, you can do a tremendous amount of, you get a tremendous amount of air difference coming in, right? Your nostrils are quite small compared to your nose. So if you're breathing in through your nose, you get much less than you would when you breathe through your mouth. And if you think about the nose in general, it's the one job that the nose has is breathing, and it really is designed to do breathing beautifully.
Okay.
So when you breathe in through your nose, the air is warmed, the air is moistened and it's also filtered. You know those little hairs in there that old men have to get cut? We
Absolutely.
all have them, not to that degree, but we all have them, and that it's doing a tremendous job for us of filtering. Plus, there's the whole idea of, that's where our immune system is first activated when things come in through the nose. That's a little bit of a bigger discussion, but nose breathing is essential for health. So if we then adopt a poor breathing habit like you're talking about, or a poor body posture, as you mentioned, we really do end up, affecting ourselves. So just from the rounded shoulders perspective that you talked about, as soon as you round your shoulders forward, you're basically inhibiting the movement of your chest and your diaphragm and everything that you would be using for breathing. So you're then making it harder for you to breathe. So it's a problem, right? It's what we said. We need to do it all day, every day. And if we're making it harder for ourselves to do, it's definitely going to affect us.
So how does dysfunctional breathing affect oral cavity conditions?
Right. So if we talked before about the nose breathing being the way that we really want to bring the air in because it's so beneficial, well then naturally, if we bring the air in a different way, we're going to lose all those benefits, right? And we're going to be making the body operate in a way that it's not designed to operate. So that's the first thing. You're all of a sudden coming to a suboptimal level. But beyond that, what happens when you breathe in through your mouth is you end up drying out the whole oral cavity, right? All of those tissues in there get dry. And what happens then? It becomes a breeding ground for bacteria and other microbes. Well, I see you smiling away. Tell me what you're thinking.
Oh, this is why I call the mouth the city dump.
The city dump. Oh, I love that. I love that. True.
Yeah, absolutely. So my understanding then is there's an innate connection between breath and oral cavity health, and dysfunctional breathing seems to change a lot of typical functioning things for systemic health and immune system functioning.
Absolutely. I mean, even in terms of specifically immune system functioning, one really concrete thing that we can talk about is nitric oxide. It's a gas that, we used to think about nitric oxide as, just like a waste gas. But then we realized it actually plays a critical role in the body. And in fact, now, even during this pandemic, the FDA fast-tracked this medical appliance that delivers nitric oxide to COVID-19 patients. So even the government is recognizing that nitric oxide is beneficial in being an antimicrobial, particularly against COVID-19. And the reason they're thinking this is because it showed benefits for the first SARS that we had. So the original SARS was, affected by nitric oxide, and now this one too. And so, like I said, the government has allowed this unit to be approved for COVID-19 patients. But what's the thing that I love about this whole nitric oxide thing is we make it ourselves. When you exhale through the nose, you are creating nitric oxide. It just, not to get too technical, but nitric oxide is created. And you can actually increase the production of nitric oxide. And you know how you do that? By humming.
What?
So, yeah. So, before we got all to having to wear masks in the stores and everything, I was just walking through the store and I was humming, because I knew that when I did that, I was increasing the nitric oxide by as much as 7 times the natural amount. Yeah. So, and I'm not talking about like a full on, when you're like in yoga or something, but just what people can do is pick your favorite song, and just walk around, hum it, and you're creating all this extra nitric oxide. Like I said, it's an antimicrobial. So whatever germ's trying to get in there, it's really going to help.
That is something I did not even know. That is really good information. So what one take-home message would you be able to share for people not really looking at nasal breathing for movement or function? So is there something that we should know or know today, know to do now to be aware of the power of breath?
Absolutely. And what I always say is, say no to the O. And what do I mean by that? If you were breathing through your mouth, you've got an O posture there. You know, sometimes it's huge, but sometimes it's just part of it. So I say no to the O. No, no mouth breathing, because it really affects you in every possible way, you know, right down to the city dump, like you said, you know. And so if we say no to the O, consciously, you know, train ourselves to keep our lips touching, then we can't inadvertently breathe through the mouth. So say no to the O, keep your lips touching so you can breathe through your nose. And if people have congestion, which is preventing them from breathing through the nose, I actually have a great video on my website that they can use. It's called the nose unblocking exercise. It works like a charm.
I would love to use that. I think that's important.
Right. Yes. Yeah. Yeah. And I actually have an ebook that I wrote. It's how to clear your stuffy nose, and it's the 3-point system that I personally used, kind of put together from all the different practitioners that I worked with, because I had chronic sinus infections, and so then of course I had to, you know, that's how I actually got into breathing work, in fact. But yeah, so if you know, say no to the O, and if for some reason you cannot breathe through your nose because of congestion, then definitely use the video or check out the ebook that's there to unblock it, because nasal breathing is hands down the #1 thing that you can do to improve your overall health.
Well, thank you so much for this wonderful information. And
you are welcome.
For saying no.
Oh, good. Thank you so much. I'm so happy that when I find, you know, get to meet and talk with somebody who is, yeah, absolutely.
All right. Thank you. Bye-bye.
Bye-bye.
How can we gauge oral cavity health? We can gauge it by using tools and observations that may suggest possible factors affecting optimal oral cavity health. There are many things to observe, but I have found these 3 items helpful in understanding possible dysfunctions to a person's oral cavity health. The Oral Health Assessment Tool is an efficient screen I like to use within my profession. It allows me to quantify observable appearances of the lips, tongue, gums tissue, saliva, as well as oral cleanliness and pain. I can then use this information to refer to other professionals, as well as to provide consult to patients and caregivers. 1. Linea alba in the cheeks. Linea alba is a white horizontal line found on the insides of your cheeks. This may suggest a sign of teeth clenching. 2. Tongue coating. Tongue coating is the appearance of a discoloration on the surface of the tongue, and is typically caused by debris, bacteria, and dead cells. This can be associated with mouth breathing and possible digestive factor. 3. Tonsil stones. Tonsil stones are white-colored stone-like pieces of debris. They are caused by food particles, bacteria, and mucus getting trapped in small pockets of your tonsils. Some complaints associated with these are throat pain, tinnitus, ringing of the ears, and halitosis, bad breath.
Prior to becoming a dysphagia specialist, I used to consider sparkly teeth important for aesthetic or cosmetic purposes. I now understand the mouth contains semi-critical bodily fluids, is the largest pathway to the lungs, and has direct interplay with sleeping, eating, motility, respiration, and digestive functioning. These are all underpinnings of how we complete our activities of daily living. I hope you found this information helpful. Ever onward.